Okay, you came home from hospital or from your cardiology appointment with a whole heap of medications or prescriptions. 4 tablets, maybe even 5, some of them twice a day, and nobody properly explained why you need all of them or what each one actually does. If that's you, this video is for you because you deserve to understand exactly what you're taking and why. And honestly, most people with heart failure feel exactly the same way. Being handed a list of medications without explanation isn't your fault, it's a failure of the system. Appointments are short, time is limited, and there's a lot to cover when someone has a critical diagnosis like this. And the why often gets left out. But the why might mean the difference between you taking them more seriously or persisting with them when you feel like they might possibly give you unwarranted side effects later on. So let's address this right now. I'm Dr. Jodie Ann Senior, a cardiologist and heart failure specialist. By the end of this video, you'll understand what each of your main heart failure medications does in plain English. You'll know exactly why your doctor prescribed multiple tablets instead of just one, and you'll understand why the combination matters. Let's start with the big picture. Heart failure treatment isn't random. It's built around what we call Guideline-Directed Medical Therapy, or GDMT. That's just the medical term for the combination of medications that international research has proven extend life and reduce hospitalization in heart failure. Think of it like a 4-legged stool. Each leg represents a different type of medication targeting a different part of what's going wrong in your heart. Take away one leg and the stool wobbles. Use all 4 and it's more stable, and the legs each do more combined to contribute to the situation than the one alone. That's why you need multiple tablets, not because your doctor is being excessive, but because each one is doing a job that the others can't, and because combined they are more powerful. They save many more lives. Okay, let's get into it. Pillar 1. You might be on a medication called something like ramipril, perindopril, trandalapril. These are ACE inhibitors. Or candesartan or Atacant. It's an ARB. Or there's a newer one called sacubitril valsartan, which you might know by the name Entresto. This latest one is called an ARNi for short. Here's what this type of medication does. When your heart isn't pumping well, your body goes into a kind of stress response. It releases hormones, particularly one called angiotensin. That constricts your blood vessels and makes your heart work harder to push the blood through them. In short, that is your body trying to compensate, trying to cope with the changes. In the longer term, this can damage your heart further. This medication blocks that response. It relaxes the blood vessels, reduces the workload of the heart, and over time, this allows the heart muscle to potentially recover. One common side effect of the older version, the ACE inhibitors, is a dry cough. This occurs in about 1 or 2% of patients. If that's you, tell your doctor. There are alternatives that work just as effectively but without the cough. Pillar 2. Carvedilol, bisoprolol, metoprolol, and nebivolol. These are beta blockers. They're special beta blockers for heart failure. When your heart is struggling, your body releases adrenaline to try and make it pump harder. Again, this is helpful in the short term, but more damaging in the long run. Beta blockers block adrenaline, another major stress or survival hormone. They slow the heart down, they reduce its workload, and they protect it from the constant stress of being overdriven. In the early weeks of starting a beta blocker, some people feel a little bit more tired or a little bit dizzy. That can be quite normal and it usually settles. Your doctor will typically start you on a low dose and increase it gradually. One critical thing, never stop your beta blocker suddenly without speaking to your doctor first. Stopping abruptly can cause rebound effects that could be concerning or dangerous. Pillar 3, Spironolactone or Eplerenone or even Finerenone. These first two are called mineralocorticoid receptor antagonists or MRAs for short. There's a brand new one called Finerenone, which is an offshoot of the MRA group. There's another hormone involved here in the heart failure called aldosterone. Aldosterone causes your body to hold on to more salt and water. This increases the work your heart has to do. Again, initially it's helpful. In the longer term, it's not helpful. That fluid can build up in your lungs. MRAs block aldosterone. They reduce fluid retention, help protect the heart muscle from further damage, and improve survival. One thing to be aware of though, these medications can raise your potassium levels. On occasions, they can impair kidney function, but in many cases, they'll assist kidney function. That's why your doctor monitors your blood tests regularly when you're on these. Pillar 4, and this one is really interesting, dapagliflozin, brand name Forxiga, or empagliflozin, brand name Jardiance. These are SGLT2 inhibitors. These were originally developed as diabetes medications, but then something unexpected happened in the research. People with heart failure who took them were hospitalized less and lived longer, regardless of whether they had diabetes or not. We now know that they protect the heart and the kidneys in ways that we're still trying to fully understand. They also have a mild diuretic effect, helping remove excess water and sugar. They are now a standard part of heart failure treatment, practically irrespective of what might have caused the heart failure. If your doctor has added one of these to your prescriptions recently, it's because the evidence is now strong enough that most people with heart failure should be on it. And then there's the fluid tablet, the diuretics. Furosemide is the most common and probably the most potent one of these. You might know it as Lasix or Furosemide. This is the medication that removes excess fluid from the body via your kidneys. It relieves breathlessness, reduces leg swelling, and makes you feel significantly more comfortable. Not everyone will need diuretics, but in the majority, we would aim to get all 4 pillars on board. Here's the important thing to understand about the diuretics. They don't improve your survival on their own, but they are important if you need them. They don't change the underlying disease, but they are what makes life livable, while the other 4 pillars do their longer-term work. Your diuretic dose may be adjusted depending on your weight and symptoms. This is normal. It doesn't mean your heart failure is suddenly worse. It means your doctor is fine-tuning your balance. So why all these at once? Because each one targets a different part of the problem. The hormones, the adrenaline, the fluid, the kidney protection. No single medication does all of that. The research is very clear. Patients who are on all 4 pillars of therapy do better. Less breathlessness, fewer hospital admissions, longer lives than patients on 1 or 2 medications or none at all. Your doctor isn't giving you more tablets than you need. They're giving you every tool that the evidence and the clinical experience says works. So let's bring this all together. You're not on multiple tablets because your heart failure is uniquely complicated. You're on them because modern heart failure treatment is built on 4 pillars, and each one is doing a different job that the others can't specifically do. Pillar 1 reduces the hormonal strain on your heart. Pillar 2 blocks the adrenaline overload. Pillar 3 tackles the fluid retention at the hormonal level. Pillar 4 protects your heart and your kidneys in ways that took us years to fully understand. And your diuretics give you symptom relief, while all of those others help longer term benefits. If you want to understand your heart failure better, your stage, your ejection fraction, and the questions to ask at your next appointment, I have a free guide linked in the description. And if you want a simple daily tracking tool that tells you when to act on your symptoms, my heart failure tracking kit is there too. Both are free. Subscribe for a new video every week, all designed to give you the clarity your appointment didn't have time to.